Καλησπέρα. Θα κάνω την παρουσίαση στα αγγλικά γιατί η ορολογία με δυσκολεύει ιδιαίτερα. In today's presentation, I would like to discuss about two big EU-funded projects, EUKIME and Incisive, in which I am involved. I am coordinating the Incisive project and I am co-leading together with Professor Manolis Tsiknakis from Fourth in Crete, a big work package in the EUKIME project that is dealing with health data, cancer imaging data, interoperability. And the reason why I want to present these two projects is because I believe they have two important goals. They are addressing two very important goals, health data sharing and creation of big data repositories and support of development of AI services in cancer imaging. So the first project I will discuss is the Incisive project. The Incisive project has started since 2020, October 2020, and it was funded under a call of the European Commission of 2019. It is receiving approximately 10 million funding to work on AI and health imaging. Our consortium consists of 26 partners all over Europe from 9 different countries, including several universities and clinical partners acting as data providers, SMEs, research and academic institutions, large industries, and other organizations. The company where I work, Maggioli, an information technology company, is coordinating the project, but we also have a lot of partners who are working on AI for health imaging and data analytics, security, high-performance computing, complex ICT systems integration, cancer clinical research and practice, as well as expertise in health data sharing, patient representation and evaluation, as well as expertise on legal and ethical issues, which is very important when we are dealing with health data sharing, as well as expertise in innovation and business planning, because we do want these systems to be sustainable in the future. The main objective of Incisive is twofold. The first major goal is to develop an AI-based toolbox that supports healthcare professionals in decision-making in relation to patient prioritization, cancer diagnosis, and prediction for metastasis. Here, of course, the targeted impact of the project is on healthcare professionals and cancer care. The second major goal of the project, which is very much linked to the first one, is the creation of an interoperable pan-European federated repository of health images, cancer images, and accompanying clinical data that enables the secure data sharing in compliance with all legal, ethical, and privacy regulations. And here, the main impact that we are targeting is for AI developers, experts in developing AI, as well as researchers who are in need of data for conducting their medical research. Coming to the first, diving a bit deeper into the first objective, the AI toolbox, it is building AI models for addressing 4 types of cancer: lung, breast, prostate, and colorectal cancer. And for each of these types of cancer, we are addressing several imaging modalities. For instance, in lung cancer, we are working with X-rays, CT and PET-CT. In breast cancer, mammography and MRI. In prostate cancer, MRI. And in colorectal cancer, MRI and histopathological images. And how are we trying to help healthcare professionals? We are developing AI for example, for classification of abnormalities. for staging, for patient prioritization. So when there are too many patients, too many imaging examinations, we are trying to find out, using the AI, findings in the imaging examination that may require the stronger interest and the quicker examination from the healthcare professional, and prioritize these images against some others who may not be as high priority. Other AI models that we're developing have to do with localization assistance, cancer staging, risk prediction for 1-year metastasis. In the case of mammographies, estimation of BI-RADS classification, in the breast cancer, in the prostate cancer, PI-RADS classification, segmentation of lesion, and many more. And for all these models, we are integrating an explainability module which provides to the healthcare professional the explanation of why the AI model is providing a certain prediction or a certain recommendation, so that he can be the ultimate judge of whether the recommendation is correct or not, of whether he will follow it or not. And this, of course, promotes the trustworthiness of the AI. We have completed the development of this AI toolbox and the different AI models that I just mentioned, and we are currently conducting the piloting of this using prospectively collected data from approximately 2,000 patients. The piloting happens in 8 different pilot studies by 8 different clinical partners in 5 different countries for the 4 types of cancer. Coming to the second objective, which makes possible the development of the AI toolbox, the data collection. Here we aim at collecting a large variety and a big mass of data that can be used for the training and validation of the AI that we are developing. We are collecting imaging data and accompanying clinical data for the patients for whom we are examining the images. We are collecting these from 9 different data providers, who in turn are in contact with 12 different clinical partners, hospitals from the 5 different countries of the pilots. We are addressing all these types of imaging data: MRI, ultrasound, mammography, histopathological images, CT, PET-CT, and X-rays. All of these images exist in the cancer imaging repository of data that we are developing. And at the same time, we are collecting information about demographics of the patients, about the treatment that they have received, gene mutations that they may have, lab results, and all these at different time points, so that the AI can be trained on the whole development of the patient. So the Incisive project is based on 2 main pillars: a clinical pillar, which is providing all the clinical expertise required for developing the AI, and a technological pillar, which is required for developing all this technology. We had 4 cycles of data collection, which are being completed now. So we started with retrospective data collection. This was the most massive part of the data collection. We proceeded with this data was used for initial training, initiation of the AI models. Then we collected prospective data, which was a more complete set of data, because we were able to collect all required time points and data for the same patient, and we could see the evolution. And this data was again fed into the AI for retraining. And then we had 2 more cycles of prospective data collection in order to pilot the solution. One, we had an observational study where the outcomes of the AI models were tested on the data and the results that were already known for a specific patient. And we are currently conducting the feasibility testing, which will give us information about how well the healthcare professionals are able to interact with the AI models. We had 3 iterations of AI modeling, as mentioned before, using all these data collection cycles. And we developed a hybrid data storage infrastructure for collecting and storing securely all this data in accordance with the GDPR regulation, and all the relevant national and EU regulations. This hybrid infrastructure allows us to store the data both centrally at a big data node that is located, maintained by our company, Maggioli, but also in the cases where the data providers didn't wish to send the data somewhere else but wanted to store it locally, we created local data nodes. And all of them were federated under the hybrid infrastructure that we developed. And this allowed us to aggregate data from multiple clinical sites in a secure way and still have this data interoperate, still be able to use it in a homogeneous way. So what we have achieved and what we will deliver by the end of March 2024, which is the end date for this project, is an AI toolbox that includes several AI models in support of decision-making and AI pipelines, combinations of AI models for the 4 types of cancer that I mentioned before, a hybrid data repository infrastructure that currently stores more than 3.7 million cancer images that can be used for training other AI technologies as well. And these come from approximately 9.3 thousand patients. All this data is, of course, de-identified, anonymized, and annotated and properly processed. They come from our 9 data providers and have already been integrated thanks to the data interoperability framework that we developed in the context of the project and the data sharing framework that allowed us to share the cancer images and the clinical data in an ethical way. But not only during the project, this is something that can be reused for sharing any kind of data in the future as well. And with this, I invite you to visit the project website for more information or follow us in our social media. And of course, I will be happy to discuss any questions or comments you may have about it. And move on to the second project that I would like to discuss, which is very much linked to the Incisive project. This is the European Cancer Imaging Initiative, or EUCIME project. It's a really massive project, as I will discuss in a second, that has been called as a flagship project by the European Commission because it is contributing to create the European health data space. The European Commission, I don't know if this is something that has been discussed at all, but it is creating at the moment a regulation for developing a European health data space that will connect data all over Europe for all kinds of data. And the European Cancer Imaging Initiative that I will present is the flagship for cancer imaging for this specific domain. The vision and the main objective of the project is to create a pan-European federated infrastructure linking and making research cancer imaging data from EU level, but also national hospital networks and research repositories accessible, ready, and reusable by any interested stakeholder that needs data for developing their work for their medical research. It is meant to be an accelerator for medical research and industry to better understand, diagnose, and fight cancer. And in the end, we want to be the leading European hub for cancer research communities, interoperable oncological data, and AI innovation. So it is actually building a whole ecosystem that connects clinical partners, data providers, existing data infrastructures that are already collected, plus AI developers, technology partners. The project is going to develop 3 main assets. So one we already discussed is high quality data cancer imaging data and accompanying clinical data. On the other hand, a number of data processing and analysis tools so that all this massive data can be analyzed, can be used, can be made useful for medical research. And all this will happen in a secure processing environment that we are building so that the data does not leave this secure processing environment, and the privacy of the patients who have consented to provide their data is not at risk. Some quantitative goals to give you an idea of how massive this project is. We plan to create a European atlas of cancer images that includes more than 100,000 cancer cases, which translates to more than 60 million images by 2025. All these anonymized and annotated so that it can be used. And addressing both common and rare types of cancer, such as breast, lung, prostate cancer, but also some rare pediatric cancers. We want to connect 30 distributed data providers from 15 countries by 2026, develop, validate, and deploy more than 50 AI models, AI tools, and clinical prediction models that can help healthcare professionals in decision support, and all this within the 4 years duration of the project. The consortium involves more than 90 different institutions, all types of expertise, and it is funded by the Digital Europe program with a 36 million investment. And all this, we want to be sustainable and provide a permanent research infrastructure for medical research. We have two main target groups, as probably derived from the previous discussion: data holders and data users. Data holders can be clinical centers that want to share data, interoperable data, but also existing research infrastructures that have already collected massive data, but want to make it interoperable with other data. Cancer screening programs that are also providing data, and any other organization interested in data altruism. Data users can be researchers and innovators in AI and medical science, as well as researchers in new therapies, in treatment, pharmaceutical companies, regulatory bodies, and many other stakeholders who are in need of data for conducting their work. There are a lot of benefits of why clinical centers would want to be part of this large infrastructure and share health data. Of course, improved data standardization and interoperability is one main reason, but also enhanced collaboration and knowledge sharing through the huge network of partners who are involved in this project. There is also a potential for revenue generation through several monetization strategies, through partnerships with data users and other stakeholders, pharmaceutical companies, for example, who are interested to invest into using the data. Increased visibility and reputation, of course, because we are discussing about a pan-European network of partners, and facilitated compliance with data sharing principles at the national level that are emerging in Greece as well lately, but also the future European Health Data Space Regulation, which is currently under construction and is soon to be officially applied for all hospitals in Europe. And all this, the project can help to minimize the effort to comply with all this and prepare the data, which is a non-neglectable effort, let's say. For data users, there are also evident advantages. The volume and quality of data that is provided through this infrastructure is incomparable to what exists today. Also the fact that it can be done through a process that is ethically and legally compliant facilitates medical research. We are also able to customize the data collection according to the scope of the medical research, and in this way accelerate the research. Accelerate the research and development, and ensure also cross-border collaboration with other organizations working on similar fields. The project started in the beginning of 2023. By the end of next year, we plan to release the first fully operational version of the platform that will aggregate all this data and enable their reuse by AI developers. And by the end of 2025, we plan to have the final release of the fully operational platform, which will then be maintained and extended even beyond the end of the project. We currently involve 21 clinical sites from 12 different EU countries in the project, all as clinical data providers. But we do hope to attract more data providers. In fact, in May of next year, there will be a call for interested data holders who want to share their data, who want to create their own data repositories, either using the central node of EUCAIM or setting up their own local node. And I invite you to stay up to date through our website and see if it is interesting to link to this effort. This is a picture of the whole more than 76 partner consortium and several stakeholders, many from industry and pharmaceutical companies as well. And I will close the presentation with a few testimonials from some high-profile colleagues from the European Commission, as well as Professor Regina Bitstan, the president of the European Radiology Society, who stress the importance of this large infrastructure and the importance of attracting even more data providers and AI developers for linking to it. Thank you very much for your attention, and I'll be happy to discuss any questions.
Την κυρία Τσάκου την πρωτοάκουσα σε ένα κατάμεστο αμφιθέατρο στο ECR στη Βιέννη, πέρυσι ήταν αν θυμάμαι καλά, ναι. Και χάρηκα πολύ πραγματικά και για τη χώρα μας από την παρουσίαση. Είστε υπεύθυνοι του τομέα υγείας στο Maggioli Group, σωστά? Σωστά. Στο ελληνικό κομμάτι.
Στο ελληνικό, το ερευνητικό κομμάτι.
Το
ναι.
ερευνητικό κομμάτι. Η ερώτησή μου είναι ποιο ίδρυμα και τι βοήθεια θα απευθυνθεί από εσάς για να έρθετε σε επαφή? Προσπαθούμε να κάνουμε μια συνεργασία, αλλά θέλω να το ακούσουμε όλοι.
Μπορούμε να λειτουργήσουμε ως η πόρτα για κάποιες από αυτές τις μεγάλες πρωτοβουλίες. Η εταιρεία μας ανέκαθεν εδώ και πάρα πολλά χρόνια συμμετέχει σε ευρωπαϊκά προγράμματα, επιδοτούμενα ευρωπαϊκά προγράμματα έρευνας και έχουμε πολύ καλή γνώση του χώρου του ερευνητικού στον τομέα της υγείας και δει τώρα τελευταία στο χώρο του AI που είναι χρησιμοποιείται όλο και περισσότερο. Οπότε, ερχόμενοι σε επαφή μαζί μας, μπορούμε να γίνουμε η πύλη, αν θέλετε, για κάποιες από αυτές τις πρωτοβουλίες, για σύνδεση με κάποιες από αυτές τις πρωτοβουλίες. Για παράδειγμα, εάν υπάρχουν ενδιαφερόμενοι να συνεισφέρουν δεδομένα στο αποθετήριο εικόνων που παρουσίασα, το EUCAIM, το οποίο θα έχει και χρηματοδότηση, θα γίνουν δηλαδή full partners στο consortium, το ήδη υπάρχον, μπορούμε να έρθουμε σε επαφή, μπορείτε να επικοινωνήσετε μαζί μου και εφόσον ανακοινωθεί το call κάπου τον Απρίλιο-Μάιο του 2024, μπορώ να σας φέρω σε επαφή και να δούμε και πώς μπορούμε να επεκταθούμε και σε επόμενες συνεργασίες.
Υπάρχει μια ερώτηση από τους διαδικτυακούς ανθρώπους που παρακολουθούν, που λέει ότι παρότι δαπανήθηκαν πάρα πολλά χρήματα και χρόνος για την ανάπτυξη της τεχνητής νοημοσύνης, για ποιο λόγο δεν βλέπουμε κλινικές εφαρμογές σε μεγάλη κλίμακα? Τι θα συνιστούσατε στους ακτινολόγους από άποψη εκπαίδευσης προκειμένου να έρθουν πιο κοντά στην τεχνητή νοημοσύνη?
Πάρα πολύ ωραία ερώτηση. Ευχαριστώ πολύ. Είναι μια ερώτηση που θα μπορούσαμε να συζητούμε βέβαια για όλο το απόγευμα. Νομίζω ένας από τους βασικούς λόγους, και είναι ένας από τους λόγους που θέλησα να παρουσιάσω τα δύο έργα, είναι ότι δεν υπάρχουν benchmark data πάνω στα οποία να γίνει η αξιολόγηση αυτών των συστημάτων. Όλα αυτά τα συστήματα αναπτύσσονται με βάση συγκεκριμένα training data sets, τα οποία περιέχουν συγκεκριμένους ασθενείς, συγκεκριμένες περιπτώσεις. Αυτές οι περιπτώσεις προφανώς, όσο ευρύτερες είναι και όσο πιο πολλά είναι τα δεδομένα, τόσο μεγαλύτερες οι πιθανότητες να καλύψουν ακόμα και outliers, ασθενείς δηλαδή που δεν έχουν μια εξέλιξη αναμενόμενη, που δεν τη βλέπετε συχνά. Επειδή όμως δεν έχουμε πολλά δεδομένα συνήθως, τα AI συστήματα έχουν περιορισμούς. Δηλαδή, έχουν καλή απόδοση για συγκεκριμένα μηχανήματα, με τα δεδομένα των οποίων έχει γίνει η εκπαίδευση, έχουν καλή απόδοση για συγκεκριμένες περιοχές, πάλι σε σχέση με τα δεδομένα που έχουν χρησιμοποιηθεί, αλλά αν πάμε το ίδιο σύστημα να το χρησιμοποιήσουμε σε απεικονιστικές εξετάσεις, αν έχει γίνει, λέω ένα τυχαίο παράδειγμα, η εκπαίδευση πάνω σε Siemens μηχανήματα και πάμε σε Philips μηχάνημα που έχει δίνει διαφορετικού τύπου δεδομένα, μπορεί να υπάρχουν αποκλίσεις, να μην έχει τόσο καλή απόδοση. Οπότε είναι πάρα πολύ σημαντικό να έχουμε αυτά τα αποθετήρια των πολλών δεδομένων που παρουσίασα, τα οποία συλλέγουν δεδομένα από όλων των ειδών τα μηχανήματα, από όλων των ειδών τις περιπτώσεις ασθενών, από όλες τις πιθανές εξελίξεις που είχαν οι ασθένειες, έτσι ώστε να λαμβάνουν υπόψη τους όσο το δυνατόν περισσότερες περιπτώσεις και να είναι όσο πιο robust γίνεται. Εφόσον γίνει αυτό, νομίζω ότι σιγά-σιγά περνάνε και στην κλινική πρακτική. Υπάρχουν σήμερα κάποια συστήματα, περιορισμένα, δηλαδή όχι όλα αυτά που παρουσίασα, αλλά συστήματα για patient prioritization, για παράδειγμα, ή συστήματα radiomics, AI-based radiomics. Υπάρχουν συστήματα, ειδικά στον καρκίνο του μαστού, που είχαμε δεδομένα από νωρίς και είναι πιο ώριμα εκεί τα μοντέλα. Αλλά πέρα από αυτό, και θα κλείσω με αυτό σε σχέση με την ερώτηση τη συγκεκριμένη, νομίζω ότι είναι πολύ σημαντική, πέρα από την οποιαδήποτε απόδοση των συστημάτων AI μπορούμε να πετύχουμε ως τεχνολόγοι, είναι πολύ σημαντικό να υπάρξει και εκπαίδευση των κλινικών experts πάνω στη χρήση των συστημάτων αυτών. Γιατί όσο και robust να τα κάνουμε, πάντα θα υπάρχουν ατέλειες, πάντα θα υπάρχουν περιπτώσεις. Έτσι κι αλλιώς ο ακτινολόγος, ο ογκολόγος, ο γιατρός είναι αυτός που θα έχει τον πρώτο λόγο και τον πλήρη έλεγχο. Πρέπει να καταλάβουν καλύτερα οι κλινικοί ποιοι είναι οι περιορισμοί των συστημάτων αυτών και πώς είναι καλύτερο να τα χρησιμοποιήσουν, ώστε να μπορέσουν να τα αξιοποιήσουν στο μέγιστο βαθμό.
Σας ευχαριστούμε. Έχετε κάνει μια πολύ καλή ομιλία και μας έχετε κεντρήσει το ενδιαφέρον. Νομίζω ότι θα πρέπει να συνεχίσουμε τη συζήτηση την άλλη εβδομάδα ή το Γενάρη, να μιλήσουμε όλοι για το πώς μπορούμε να συμμετάσχουμε κι εμείς, γιατί κι εμείς έχουμε πολύ υλικό το οποίο μπορούμε να προσφέρουμε στην βάση των δεδομένων τα οποία έχετε. Μία ερώτηση θέλω να κάνω, πρωτού δώσω το λόγο στον επόμενο μιλητή. Πώς σκέφτεστε να το δώσετε αυτό το σύστημα στην πράξη? Θα το δώσετε δωρεάν, θα το περάσετε δωρεάν, θα υπάρχει κάποια εταιρεία που θα το πουλάει, θα το ενσωματώσετε με κάποια άλλη εταιρεία? Γιατί υπάρχουν χιλιάδες, όχι χιλιάδες, αλλά υπάρχουν αρκετά AI τα οποία τρέχουν αυτή τη στιγμή με άλλους πρωτοβουλίες.
Θα εξαρτηθεί από... είναι πολλά τα AI εργαλεία που θα δημιουργήσουν και τα δύο έργα, και το Incisive και το EU που παρουσίασα. Θα εξαρτηθεί, φαντάζομαι, από τον owner του κάθε εργαλείου, πώς θα θελήσει να το εκμεταλλευτεί. Κάποιοι θα τα δώσουν, ξέρω από τώρα ότι σκοπεύουν να τα δώσουν open source, οπότε θα είναι ανοιχτά για περαιτέρω εκπαίδευση και ευελπιστούμε σε κάποια χρονική στιγμή και πλήρη ενσωμάτωση στην κλινική πρακτική. Κάποια άλλα που τα αναπτύσσουν εταιρείες που έχουν εμπορικά ενδιαφέροντα θα δοθούν μέσα από τις εργαλειοθήκες αυτών των εταιριών. Κάποια άλλα ενδιαφέρονται ήδη μεγάλες εταιρείες που συμμετέχουν στην κοινοπραξία, όπως η Medtronic, η Siemens, η Philips. Έχουμε πάρα πολλές μεγάλες εταιρείες και φαντάζομαι ότι θα θελήσουν να τα ενσωματώσουν στα μηχανήματα απεικονιστικών εξετάσεων που ήδη προσφέρουν. Οπότε θα παίξουν όλα τα business models.
Σας ευχαριστούμε πάρα πολύ. Επιφυλασσόμαστε να τα ξαναπούμε.
Να διευκρινίσω ότι η συμμετοχή στο αποθετήριο των εικόνων και το data sharing είναι προφανώς δωρεάν και όχι μόνο δωρεάν, έχει και πολλά πλεονεκτήματα για τους κλινικούς εταίρους μας.
Μάλιστα.
Ευχαριστώ πάρα πολύ για την πρόσκληση.
Ευχαριστούμε πολύ.
Και εμείς ευχαριστούμε.